Hello everyone, welcome back to Inkmed. The today's session we will be discussing about the UPSC CMS 2021 OBGYN previous year questions and fast recall and one-liners. These are not just UPSC CMS questions. Many of these concepts have been repeatedly asked in NEET PG, FMGE, INI-CET. So don't just memorize the answer. Understand the concept behind each question because that's exactly how examiners repeat them. Let's begin. Indications of vaginal examination during labor. Remember the three important indications. At the onset of labor, to monitor progress of labor after rupture of membranes when indicated. Avoid unnecessary repeated examination because they increase the risk of infection. Next, RH isoimmunization. A very important concept. Indirect comb test is performed in the mother to detect antibodies. Direct comb test is performed in the baby to detect antibodies attached to fetal RBCs. The fetus is at risk of hemolytic anemia and hydrophytalis. ICMR criteria for COVID exposure. A pregnant woman is considered as exposed if travel to the affected area within 14 days, close contact within 1 meter for more than 15 minutes, direct exposure to body fluids of a confirmed patient. These public health concepts are commonly tested. Next, septic abortion. Danger signs include altered sensorium, hypothermia, septic shock, multi-organ dysfunction. Remember that hypothermia is actually a bad prognostic sign. Next, fetal growth restriction. FGR occurs due to placenta insufficiency. Important association. Oligohydramnios, brain sparing effect, reduced blood flow to kidneys. It is a favorite image based topic. And then failure rate of contraceptives. Remember these highly tested numbers. LNG IUS has one of the lowest failure rates. Deport methoxyprogesterone around 0 to 1 per 100 women here. Norplant is similar. Levonorgestrel pills have a comparatively higher failure. Always knows the relative effectiveness. Next, ormeloxifene, frequently repeated. Remember, developed by CDR by Lucknow. It is a selective estrogen receptor modulator. It is a non-steroidal drug and weakly contraceptive. Students often confuse with these steroidal contraceptive. Next, again, ormeloxifene. Remember, it is a non-steroidal SERM developed in India. Next, steroidal contraceptive supplied under government programs biphasic fields. Absolute contraindications to combine oral contraceptive pills include history of thrombosis, severe hypertension, diabetes with vascular disease, gestational trophoblastic neoplasia. Always revise WHO medical eligibility criteria. After male sterilization, additional contraceptive is required for about 2 to 3 months or until semen analysis confirms azoospermia. WHO abnormal semen parameter is viscosity greater than 4. The causes of precocious puberty, the difference between central and peripheral causes. McCune-Albert syndrome causes peripheral precocious puberty. In pubertal menorrhagia, always rule out coagulation disorder, especially von Willebrand disease. WHO lower normal sperm concentration is 15 million per milliliter, a very commonly repeated. Next, the risk factors of IPD, multiple partners, low socioeconomic status, previous STI and young age. Most common ovarian tumor is postmenopausal in women is epithelial ovarian tumor. Mage syndrome, classical triad. Okay, think of Mage whenever this triad has happened. Okay, so classical triad is a fibroma, ovary, and ascites and pleural effusion. Okay. Next, young woman with 16 weeks sized uterus, negative pregnancy test, and the most likely diagnosis uterine fibroid. Okay. Next, postcoital bleeding in a 39-year-old woman. So first to investigate with pap smear to exclude cervical pathology. Next, procedentia means it's complete uterovaginal prolapse with a complete eversion of the vagina. Next, active phase cervical dilatation is a primary gravida. It's approximately 1 cm per hour. Engaging transverse diameter is biparatal diameter is 9.5 centimeters. It's a very important anatomy question. Next, compared to mature breast milk, colostrum contains more protein and immunoglobulins. Next, non-lactating woman may ovulate as early as 4 weeks after delivery. Remember this counseling point. Okay. Outlet forceps prerequisites. Fully dilated cervix, rupture membrane, empty bladder, head on pelvic floor. Next, normal vaginal pH 4 to 5.5. Maintain by lactobacillus. Next, Gardner duct cyst located on the anterolateral vaginal wall. Embryology favorite. Next, endometrial biopsy for ovulation assessment date 21 to 23. Remember, the 7 days before expected menstruation. Primary dysmenorrhea treatment, NSAID first line, combined oral contraceptive if required. Obesity causes infertility by affecting ovulation. The weight reduction significantly improves the fertility outcomes. Ideal weight gain in pregnancy with normal BMI is 11 to 16 kg. Blood volume increases during pregnancy by approximately 40 to 50%. This produces psychological hemodilution. Contraindication to external cephalic version. The placenta previa multiple pregnancy oligoheteromonous non-reassuring fetal status. Next, antepartum hemorrhage. Bleeding after 28 weeks of pregnancy and before delivery, which is not a risk factor of preeclampsia, placenta previa. The common risk factors include chronic hypertension, diabetes, multiple pregnancy, obesity, and previous preeclampsia. Spiegelberg criteria diagnose ovarian pregnancy. Remember, the tube is normal. The sac within the ovary connected by ovarian ligament. Daily fetal movement counting is a simple and reliable assessment of fetal well-being. A very important community medicine integration. Next, routine antenatal ultrasound helps detect fetal anomalies, multiple pregnancy, and viability. Iron supplementation should begin from around 16 weeks in all pregnant women as per national guidelines. Next, physiological edema of pregnancy decreases with rest. Unlike preeclampsia, it is not associated with hypertension or proteinuria. That's complete the UPSC CMS 2021 OBGYN PYQ fast recall session. If you are preparing for UPSC CMS, NEET, PG, FMGE or INI-CET, make sure you revise these one-liners multiple times because these topics are frequently repeated in different formats. If you found this session helpful, don't forget to like the video, subscribe to Inkmed and share it with your friends. Comment below which year PYQ recall you want next, 2022 or 2023 or 2024. Thank you for watching and I will see you in the next high yield revision session.